Thank you, Steph. Now, a Target 12 consumer investigation. UHIP 1 year later. Last September, Rhode Island launched its biggest IT project ever, a new computer system for benefits called UHIP. The price tag, $445 million and climbing. But the launch left thousands of people struggling to access benefits like Medicaid or food stamps. Target 12 consumer investigator Susan Campbell has tracked each development, and new tonight, her one-on-one interview with the governor to look back and look ahead.
The governor tells me the system has improved, but she says it's not where it needs to be.
What's going on?
Jessica DeAngelis dreads taking her 4-month-old daughter Quinn to the doctor.
They say she has no insurance.
Jessica says Quinn's Medicaid coverage has been an issue since the day she was born.
They sent me about 10 insurance cards so far, some with different last names.
Jessica says she spends hours on hold trying to get answers.
I just don't know what else to do.
Medicaid is just one of the programs run through the state's new UHIP computer system, which launched September 13th, 2016, more than a year late. Almost immediately, the problem started. The lines were hours long at DHS field offices. Clients couldn't get through on the phone.
I'm just waiting for my number to be called.
SNAP benefits for food and supplemental SSI payments were delayed for thousands.
I'm just barely surviving.
Child care and long-term care facilities have missed payments.
We continue to provide the care without getting paid.
And Medicaid patients have inexplicably lost their coverage.
All these people that are suffering from all this, it's just wrong.
Frustration mounted in October when Target 12 revealed the federal government had sent these 2 letters warning state leaders the system wasn't ready to launch. Those letters set off a series of legislative oversight hearings.
We're all suffering UHIP fatigue.
Several senior officials were forced to resign, and Deloitte, the company that built UHIP, refunded $27 million. One of the things we've tracked this year is the backlog of cases. Once the state weeded out duplicates, you can see it hit its peak in February at about 14,000. Since then, it's steadily declined, right now at about 3,700.
So here we are a year into this. A lot of time, a lot of inconvenience, a lot of hardship, and it's still not, it still has bugs. So I'm not a happy customer.
Rhode Island may be on the hook to cover the cost of all of the benefits overpayments for SNAP benefits for food. Where does that money come from?
You know, that'll be a discussion I have with Deloitte. I would argue that they ought to reimburse us.
What are some of the lessons that you've learned?
Accountability, communicating, rolling it out a bit at a time. We've used a lot of those lessons to improve other projects, like we just had a successful DMV software implementation. You know, it worked because we learned from our mistakes.
Deloitte has already been paid about $200 million for UHIP. The company has not responded to our repeated requests for comment. With the Target 12 investigator, Susan Campbell, Eyewitness News.
Thank you, Eric. New details in a Target 12 consumer investigation, UHIP 1 year later. Live at 5, we showed you the human toll of the botched rollout of Rhode Island's new benefit system. New at 6, the stunning document that shows just how wrong the numbers were when state officials sold UHIP to taxpayers. Target 12 consumer investigator Susan Campbell has those details from the State House.
Target 12 recently uncovered a document from October 2015. It promised UHIP would pay for itself. We're talking hundreds of millions of dollars by 2018. Before the UHIP system went live, Rhode Islanders were promised a modern computer system that would streamline benefits for hundreds of thousands of people. According to this document from 2015, UHIP will save Rhode Islanders more than $90 million each year, including $40 million general revenue, and pay for itself by fiscal year 18 through waste and fraud prevention, operational improvements, more efficient services, and error reduction. But since the system launched 1 year ago, it's been riddled with problems and hasn't saved a cent.
Is there a chance the system will ever pay for itself?
I think it's too soon to tell, certainly not by 2018. Here's what I would say. The system was clearly necessary. It had to be done because the federal government said we weren't going to be in compliance with the law if we had the old system. I think over time, yes, it has the potential to has the potential to pay for itself.
Rhode Island stopped paying Deloitte, the company that built the system, in January. The state also received a $27 million credit from the company.
Are you expecting more credits from Deloitte?
I don't want to give away the whole strategy, but they really didn't do right by us. There's a lot more negotiation to be done, either a credit or a lawsuit. Right now they have hundreds of employees who are here, and we're not paying them. And that's what I plan to do, is continue to demand them to deliver.
What do you just say to the Rhode Islanders who are going to watch this and they're going to say, but Governor, you're talking about holding Deloitte accountable. Should you be held accountable?
Absolutely. And that's why I'm working so hard to fix it.
This obviously isn't your only job. How much time a week do you devote to UHIP?
Hours. I feel that I owe it to people to get it right.
According to the Department of Human Services, the goal is to stabilize the system by March. Deloitte has not responded to our repeated requests for comment. With the Target 12 investigator, Susan Campbell, Eyewitness News.